Hi, I'm Jane Schuler, and I'm a nurse practitioner with Palliative Care at Great River Health.
And I'm Christina Metternich. I'm a nurse practitioner also with Palliative Care here at Great River Health. Palliative Care is a specialty service that provides care to patients who have serious illness or a chronic illness at any stage. We focus on goals of care and focusing on quality of life. We want to assist with symptom management if we're able to, and we want to focus on promoting somebody's choices with their health care.
We focus on really what we call different domains of suffering. And there's physical, where we think of pain, nausea, constipation, but there's also emotional, spiritual, sometimes relational, and even practical. People have trouble getting to appointments, even just getting basic needs met at home. So we have a team approach.
Those on the interdisciplinary care team with Palliative Care include the Palliative Care nurse practitioners, the registered nurses, and the Palliative Care social workers. And typically, we see patients together when we are in our clinic settings. We want to make sure that we allow for plenty of time for the patients to address any concerns that they may have, and so we can provide a thorough assessment. Some of the things that you could expect from your Palliative Care team and your visit would be a collaborative approach, also a support team that is going to know you as an individual and know what it is that you want or what it is that you don't want when it comes to your medical care and treatment.
And I think we also do a lot of exploration. What does the patient and their family understand about what is going on with their disease process? We do a lot of education then about that disease process and help the patient and family understand what to look for in the future and plan for the future.
We typically try to identify a goal and focus on that goal and really work on trying to get somebody to their goal, whether it be a hobby, whether it be, I haven't been able to go fishing for a while, and we're able to get them fishing.
Some classic examples of disease process that we see, probably our largest volume is in our cancer center. We do see people with sometimes curative cancers, but a lot of times more stage 3 to stage 4 cancer. Our focus then is more on symptom management and helping with stress of disease. But we also see people in clinic, in the hospital, and even in our client center with heart disease, lung disease, dementia, maybe after a stroke, or even just a tough hospitalization where someone has a bad pneumonia, or we were very involved with COVID.
There are several ways that you can seek our palliative care program here at Great River Health. One is a self-referral, so any patient may call and request our service. The other is through your primary care provider, asking them for a palliative care referral. You can ask your specialist provider for a palliative care referral. And sometimes, once we have seen a patient in the hospital, we identify that maybe they might benefit from our service, and we try to offer it at that point as well.
With palliative care, sometimes people will say it's too soon to start palliative care, but we actually can be started at any stage of serious illness.
Many patients ask us how palliative care is billed, and so we want to address this. We are considered a specialty service, and we are billed as a specialty service through insurance.
In palliative care, we do talk about hospice. We talk about hospice as a step down the road, or maybe sooner, depending upon where a patient is in their disease process.
And sometimes it is just very comforting to patients and families to be able to discuss any of their concerns ahead of time before it's ever maybe needed or the crisis has occurred. Palliative care really appreciates being a part of your healthcare journey.